Okay, in the trenches. Hypoxia. Okay, case vignette today, a woman around 60 years old, long-standing type 1 diabetic with an autonomic neuropathy. Here for a checkup and to assess her for orthostatic hypotension. Of note was a pulse ox of 76%. She was not short of breath. Her lungs were clear. She had no nail polish on, her fingers were not cold. What to do? Okay, so when you think of hypoxemia, as opposed to hypoxia, hypoxia is a low pulse ox, low measurement of oxygen. Hypoxemia is where you have tissues that are not getting enough oxygen. I went right to an ABG, and she had a PO2 of 96 and normally a gradient. That kind of made me not worry. There was a discrepancy between our pulse ox and our O2 ABG. So what could this be? It could be inaccurate readings of her pulse ox due to cold fingers or impaired circulation, and diabetics usually don't get impaired circulation in the hands. Her hands could have been cold for whatever reason, but we're in the middle of summer. The only other thing that could do this, and I have no reason to believe that, is metahemoglobinemia. And metahemoglobinemia could be congenital or acquired. We know it's not congenital. If it acquired, if she recently received benzocaine or lidocaine topical spray, and once in a while certain medicines do this, such as nitrates, nitrites, dapsone, or sulfa. I don't think she has any of this, but I am getting a metahemoglobinemia. Getting back to hypoxia, if she were hypoxic, then we'd have to figure out the cause. Okay, hypoxemia is decreased oxygen in the blood. Hypoxia is the reading. And there are really 5 mechanisms of hypoxia, and I believe I did this on a much earlier in the trenches. A shunt, a VQ mismatch, hypoventilation, high altitude, and diffusion block. She has no underlying lung disease. She's not a smoker. Her ABG did not show an elevated CO2. So she is not hypoventilating. This is not a high altitude. Her lungs were clear. If she were hypoxic, and if the ABG showed her to be hypoxic, she'd have to go for evaluation, probably do the ER and start off with a chest x-ray. And even though her lungs were clear, we'd have to evaluate her for heart failure or some form of parenchymal lung disease. The other thing we'd have to think about is a pulmonary embolism, and lungs would be clear there, but she's not short of breath at all, and her pulse ox is normal. So I'm not doing anything else about it, but every day in the office there's something interesting. That's it.